Hey everybody, Leah Klett here with the Christian Post, and I'm so excited today to be joined by Dr. Paul Osteen. We are discussing the Mobilizing Medical Missions Annual Conference held this year at Lakewood Church in Houston on February 16th. Dr. Osteen, I'm so honored to speak with you. You do such important work, and it's really exciting to read about it, to see everything that Lakewood is doing. But I want to jump in and hear from you about why you and your wife decided to start the M3 conference and really what inspired that.
Yeah, Leah, I can tell you that for the last, let's see, since '07, which would be 17 years now, we've spent 4 to 5 months a year relieving missionary surgeons in remote parts of Africa. And one year I'd been doing this like 10 years at the time. And one year I was leaving this one area I was working out near Angola, in Zambia. And as I was leaving, one of the physicians there told me, he said, "Paul, do you realize that you have been the only qualified surgeon in an area the size of Louisiana for the last 4 months?" And I thought about that. And then about 36 hours later, I was landing in Houston, and we have 2,500 physicians in one zip code here in Houston. And I just felt like God put it on my heart. What if you connected the real needs, the people that don't have access to healthcare, with the people that can provide that and help with that? And so really that was the beginning of M3, just to say, listen, we're gonna launch an opportunity for people to do three things: to connect with each other, because a lot of people have a desire to help. They just don't know how. And that was me for many years. I was a practicing physician, but I had no idea how I could actually make a difference in under-resourced areas. So number one, to connect with people. Number two, to be inspired. And so what we do, Leah, is we bring people from all around the world that are doing the work. And I tell everybody they're knee-deep, fingernails dirty, doing the work of advancing the kingdom in very difficult and underserved areas. We bring those people to our church, to this conference, and allow them to speak. And hopefully people will be inspired as you hear from people like this year, Stephen Foster is going to speak. He's been 50 years a missionary surgeon in Angola, the war-torn nation of Angola. Well, that's very inspiring to hear somebody like that speak. And then the third thing is that we wanted people to be able to what we say is find their purpose. We have about 75 exhibitors in our hall. These are organizations that are making a difference around the world that need volunteers. So there's actually tangible ways you can say, hey, listen, Samaritan's Purse needs help with disaster and relief. They need physicians, nurses, logisticians, IT people. Or I can go to another organization, they need physicians, and this is where I can serve. So hopefully people can, find a place that they can serve via all the exhibitors that we have in our exhibit hall.
Well, this year's conference theme is the least of these, which of course is based on Matthew 25. How does this theme resonate with current global health challenges?
Well, when Jesus separated the sheep and the goats there in Matthew 25, it was both based primarily and only on how they treated the least of these. That is the naked, the hungry, those that need water, clothing, those that needed health care, those in prison. You know what? All you have to do is read the headlines right now, and that is exactly what's going on around this world. I think about, Gaza, I think about Yemen, I think about Sudan, I think about all the different areas in the world that are just suffering right now. I think God cares about those people. And I think, we as believers can be lulled to sleep by the numbers and by the sheer volume of the problems that are going on. And yet I think we have to keep our hearts tender to say, is there anything that I could do to help in those situations? Because God cares about those people. Sometimes all we can do is pray. Right now in Gaza and that situation, we can't get in there to help, but we can pray. There are other places like Sub-Saharan Africa, other places around the world where you can really make a tangible difference. And so I think that Matthew 25 is my life verse, Matthew 25:36. When you cared for me, when I was sick, you cared for me. So I think, based on the world that we live in right now, there are a lot of opportunities to care for the least of these.
Well, speaking of caring for the least of these, you recently spent time in Zambia
Right.
working at a hospital over the summer. Can you share a little bit about this experience?
Yeah, it was a very, I don't mean this in any way weird, but it was a very typical trip where you're out in the, I was out in the very, very remote areas of Zambia. And I was relieving a missionary surgeon so he could go back to New Zealand and see his family and friends. And during that time, I was able to take care of hundreds of people who have little or no access to good health care anywhere but right there in that mission hospital in Zambia. And so let me just give you a typical example. One lady came, one young mom came very urgently to the hospital. She had delivered 2 hours before in her village.
Oh,
And she had a baby that was born with the intestines outside the abdomen. And so fortunately, God was with her. She got the baby to us quickly. We were able to operate on the baby, 3 different operations. But what you have to do there is you have to protect the intestines, and then eventually you put the intestines back in. And even when you do that operation, Leah, I should say, many times that there's no nutrition over there. You can't give fancy IV nutrition like we can in the United States. So the likelihood of that child surviving is very low. But God was gracious. For some reason, about 3 or 4 days after I closed the abdomen, the baby's little intestines started waking up. She was able to start taking milk. And about 3 weeks later, this child was discharged to her home, to her village home with her mom. Mom was just absolutely ecstatic. So despite the odds of being against this little child, God was gracious. And this is just one story amongst many. And in no way am I saying I'm the hero, because that child should have died there, even with good surgical care. But God's hand, I liken it to, you put your 5 loaves and 2 fish in Jesus' hands, watch and see what he can do. And that's exactly what happened. Other people were burned badly. Other people had difficult infections and things like that. So I would say we did hundreds of operations during that 4-month period, and God was gracious. Most people did very, very well.
wow.
So many young, or so many pregnant moms came, and it just is heartbreaking to think you labor in a village and you have an obstructed labor and you need a C-section, and you're 20 hours from a place that can do a C-section for you. So I just think that those thinking of those young moms with obstructed labor not having access to a C-section compels my heart, and I just don't think I think that's something that we can make a difference in.
Well, and you've been holding this conference for a few years now. Can you share some of the fruit that you've seen over the years from this conference?
Yeah, we've had lots of people go out with different organizations that are now doing part-time or some even full-time missions. So they came to the conference wanting to know how they can be involved. Now they're involved in short-term or even sometimes long-term missions. As a matter of fact, I just had a gentleman who came in 2019. He was compelled to want to go and serve, and he served for 2 years in Nepal. And he's one of our speakers this year. His name is Dr. Danny Joseph. But anyway, he was compelled. The other thing that happens, Leah, that's really cool is that, like, one particular year, we had all these people coming and organizations coming that were all working in Malawi, very, very underserved country of the world. But these organizations that were coming to the conference didn't know each other. So to me, it's just a blessing to be able to connect these people that are serving in the same country. And all of a sudden now, instead of competing with each other, they're collaborating with each other. That's a blessing. And then let's see, there was one other story I was going to tell you, but really people just being mobilized. That's why we call it mobilizing medical missions, just getting people mobilized to take the next step. Some people just hear and don't do anything. That's okay. God's still dealing with their heart, but other people, God puts it on their heart to take that next step. And that's what we always are hoping for. You know what? You just do the next step that God has instructed you to do. And it may be praying for 10 years before you do anything, or it may be immediately going. But we've seen actual fruit of people being mobilized to go out into the world to make a difference.
So, how does the M3 conference really cater to both medical professionals and individuals without really a medical background who just want to contribute to global health initiatives?
I can tell you that. 1st hand, I can tell you that in the efforts of medical missions, we have one of the most needed things are people in IT, people that can repair vehicles, people that can help maintain hospitals. And that's not something that I know how to do. I know how to operate and take care of patients, but there are so many other infrastructure needs amongst these mission hospitals that people can be involved. And then also, Leah, you can be involved in local missions. You don't have to go overseas. We have a gentleman by the name of Bob Pagalo coming. He's from Albany, New York. He works with the very underprivileged inner city people there in Albany, does a tremendous work. We have people that will talk about refugee care. You don't have to be medical to do refugee care. We have people talking about dealing with human trafficking. Again, not something that you need to be involved in medicine. So I like to say it like this. There's something for everyone at M3. You know, you come and just let God speak to your heart, because there's some place that you can be involved, maybe here in Houston, in your local area, and maybe around the world.
Yeah. So this conference is supporting Sim USA Angola project,
Right.
correct?
That's right.
Tell us more about this project and why it was specifically chosen.
Well, Dr. Stephen Foster, who I already mentioned, has been 50 years in Angola, and this is his hospital. And what this money will do will go to the hospital to provide care for people who cannot afford care. And so to me, it's a real blessing to be able to say, hey, you have a pregnant mom that needs a C-section. You have a burn patient that needs care and grafting. You know what? We're just contributing to the benevolence fund at that particular hospital so that they can provide that care to underserved and under-resourced and poor people.
Well, Dr. Osteen, just one more question. How can people get involved with this conference and where can they register to attend?
Yeah, it's really easy, m3missions.com. And you can get all the information, including the schedule, see the speakers, see past conferences. You can watch videos. It's a really good website that, you know, people can not only register for the conference, they can find out all about M3.